psychological abuse of my patients, sex before marriage, and breast cancer. One of the things in this whole conversion process that got me thinking about this, and after this really came to light after I read Dr. Callenborn's book, was in a matter of 3 weeks, I had 3 women under the age of 40 develop invasive breast cancer. One of them was 30 years old, lovely young girl, and the only thing that these 3 women had in common was that they had all had an abortion and that they had all been on the birth control pill. The one girl now has recurrent breast cancer, 8 years out from her first primary breast cancer. No family history, no genetic predisposition, no other risk factors other than those things in those 3 women. And so those things on top of Dr. Callenborn's research, which is quite revealing when you read the book, I read it several times through, it really opened my eyes that maybe I wasn't doing the right thing. The other thing that really opened my eyes was when one of my other patients brought her 14-year-old sister in to be placed on the birth control pill. And we started talking about what it meant to be sexually active before marriage, the increased incidence of sexually transmitted diseases, the increased risk for cervical cancer, all of those things, including breast cancer, but they still wanted the birth control pill. Because what she said to me is that sexuality has almost become a commonplace thing for teenagers to do. And teenagers themselves are being duped by society into thinking that sexuality and being sexually active is the thing to do. It's the thing to do to be very popular, but they're putting themselves at such significant risk for early death, either from cervical cancer, breast cancer, thromboembolic events, such as the deep vein thrombosis, those types of things. And so it's been my dedication since that time to not prescribe contraception, to promote abstinence before marriage, to tell women about the risks that they have associated with the use of oral contraceptive agents, either before their first full-term marriage or at all, including the risk of breast cancer. And many of them, when I tell them that, are very, very surprised. And they wonder why no one else has told them this before. And if I think that why no one else has told them this before is, I think there are several reasons. One, in medicine today, we're too busy to give good information. You know, we have to see so many patients in such a short period of time that we don't take the time to completely inform patients of all the risks associated with all the medications that they're taking. Two, I think doctors don't want to believe it. I think that they want to dismiss the data because if they do say this, then they've got to find another way to treat people. They've got to find a whole new way to treat things. And they don't want to take the time, or they don't have the time, or they're unwilling to go back and learn some of the things that some of us have learned on how to manage complex gynecologic problems without having to use oral contraceptive agents. And then I think the third reason is that the American College of Obstetrics and Gynecology is very pro-contraception and pro-abortion, to the point that I no longer am a member of that group. And they have done everything that they can to promote the widespread and almost totalitarian use of oral contraceptive pills in every woman. In fact, a recent statement in the paper that I read, I can't remember the doctor's name, but somebody will bring it up to me, said that birth control pills have been only second to vaccinations in the amount of preventative care that they've given to the world. And I looked at that statement and I said, if you want to prevent children, that's very, very true. But if you're wanting to prevent cancers, if you're wanting to prevent divorce, if you're wanting to prevent social injustice, sexual abuse, marriage outside of, or pregnancy outside of marriage, children born to single-parent homes, you haven't prevented a single thing. In fact, you probably increased that rate dramatically. So I am truly blessed to be sitting here with such a distinguished group of doctors. And I'm truly blessed to be able to work with patients who are interested in what we're doing, but also to be able to work in accordance with my faith in knowing that what I'm doing, I feel, is not only best for my patients medically, but also from a spiritual standpoint in promoting their faith or even just their beliefs, in trying to come to the realization that we need to change society from the inside out. that we can't just go and sit there and say this is bad and this is good and hope that people will make a decision, but by trying to be an example to these people of how it can be done and why it should be done. But I'm also grateful for what it's done for my personal life and for my marriage and for my family, and bringing me closer to the church and to my family and to my wife, who's my right-hand person. She keeps me straight and narrow. She's trying to get me into heaven as best she can. I think it's a hard job. I got the easier job. I thank you for allowing me to speak to you today, and I hope what I've said has been helpful for you, and at this time I'll entertain any questions.
Thank you, Dr. Parker. Would it be a question from the audience? Dr. Parker, how effective is the natural family planning compared to, say, the birth control pill or other?
If you look at the data that's been published in the past, Dr. Hilger's study done in 1998 looked at 5 centers and over 17,000 women. It showed an effectiveness rate and a use effectiveness rate equal to that of the oral contraceptive pill. The difficulty when you compare natural family planning to oral contraceptive pills and their effectiveness is how you are calculating their effectiveness. When we use natural family planning, we often look at it in a life table analysis, where we say if a number of women choose a certain method of contraception over 1 year, how many of those women will have a failure of contraception? When people look at studies using oral contraceptive, they only use the data while the patient was using that method. So there's going to be some methodological differences between the analysis of the data between the two methods. But I think when you look at users of natural family planning versus users of contraception, you see equal efficacy rates in the prevention of pregnancy. The second thing about looking at that data is with natural family planning, you can change your mind on a dime. You don't have to stop taking an oral contraceptive agent. You don't have to have an IUD removed. You don't have to wait for an injectable form of contraception to wear off, and you don't have to have your tubal ligation reversed. So couples can make that decision, at that moment. And many times, people within the secular media or within the ACOG media will look at that as a failure of the method, when it's actually a valid choice made by the couple to achieve a pregnancy during that cycle.
Can I ask a question? Can I ask a question? Oftentimes in medical practices, economics is obviously a very important thing and drives a lot of different decisions for doctors and groups and that sort of thing. And I've always, I guess, wondered if you go to an NFP-only practice and eliminate some of those high-dollar procedures and visits and that sort of thing, is it an economically viable thing to do? How much of an economic sacrifice is it?
Well, like I said before, it was a fairly substantial economic sacrifice in the first several years after we did this. What happens is you see a change in the dynamics of your practice. You start seeing patients for different reasons, and those high-dollar events change. You still get high-dollar events, but they're just different high-dollar events. You're seeing more deliveries than what you might have been doing before when you were contracepting. I do much more work with relation to infertility, so we're doing more laparoscopies, we're doing more procedures for the diagnosis of infertility. We're also doing longer consultations. When you change from a contraceptive mentality to a natural family planning mentality or a program, you have to become a better physician in my eyes, because you have to have a greater understanding of the pathophysiology of the disease that you're treating. And you have to understand how you can treat those diseases with either supplementation or medications that are not contraceptive in nature, or to treat those disorders through a cooperative fashion with the natural cycle of a woman, either through the use of cooperative progesterone or other types of medications. So you find other ways to treat, and I think you become a much better physician. You open yourself up to a much more holistic approach. And so you may not be seeing as many patients, but you're seeing patients for longer periods of time, which changes the billing and the coding. And you're doing more deliveries, and you're doing more ultrasounds, and you're doing more surgeries than what you were doing before. As I often say, the difference between me and other surgeons that I work with is that they're usually in the destructive mode, doing hysterectomies, removing ovaries, removing fallopian tubes. And I'm more in a restorative mode, where we're doing either laparoscopies or microsurgical techniques to try and restore the woman back to normal fertility. And so I see a lot of women who are trying